I'm Dr. John Mulliken. It's a pleasure for me to summarize the presentation that I gave at the original Teen Forum. Initially we called it a Teen Symposium, but since symposium comes from the Greek meaning a drinking party, I thought the term was improper. Now, I may not know anything about Twitter, Facebook, or MySpace, but I do remember what it's like to be a teenager. I remember the changes that were occurring both physically and socially, and I remember the importance of trying to do my best to fit in terms of clothes and hair and style. And I guess the most important thing I remember is just to feel good about my appearance along with my classmates. I thought you'd be interested in seeing photographs of two young men with a cleft lip. The first is Zach Johnson, who was the 2007 Masters champion. He has a microform cleft lip on the left side. Certainly didn't hold him back. This, of course, you all know is Joaquin Phoenix. He has a pretty obvious microform cleft lip. Joaquin, in all the movie books and magazines, says that it's just a scar on his lip, but I sent him an email once and told him that indeed it was a microform cleft lip, that I could make it look better, but he never responded. And as you know, Joaquin's gone a little crazy recently. He's running around the country trying to be a rapper. It's best to wait until facial growth is completed because any operations that are done at that time will have minimal scarring compared to scarring which occurs during the adolescent growth spurt. Usually this occurs when young women are 14 to 15 years of age and young men 18, 19, sometimes 20 years of age. This slide shows the changes that can be done in the lip in order to improve symmetry and appearance. The Cupid's bow is often a little unequal, one side being a little higher than the other, and this can be adjusted quite easily with a minor procedure. This middle portion of the lip, what's called the median tubercle, is often a little thin, almost looks like a whistling lip deformity, and could be excessive show of the upper teeth. And this can be simply adjusted by adding some tissue, a graft, from the back into the middle part of the lip to plump it up and give a nice symmetrical line to the lip. Sometimes the scar of the lip is a little bit flat or indented, and again, a graft from the back can be put underneath the scar to lift it up to simulate the column on each side of the center of the lip. Finally, in boys only, I sometimes put a little hair graft into the scar to break it up. Changes can be made on the nose as well after you've completed facial growth. Nose can be a little bit wide, and this can be measured and compared to normals. I can tighten the nose to make it narrower. I can make the tip more narrow by bringing the cartilages together, and these operations can be done usually from the inside of the nose so you don't see any scars. Another important functional aspect of the nose, as many of you know, is that you have trouble breathing on the side of the cleft. And young people with bilateral clefts could be on either side, but usually with a unilateral cleft, it's on the side of the cleft. The septum, both the cartilage and the bone, are bent to one side. And once you're fully grown, that septum can be straightened, taken out to improve your breathing. And this is again done from the inside of the nose. Often the nose is a little broad, as you can see in this slide. The tip is a little irregular, and the upper part of the nose, the pyramid of the nose, is broad, and the nose can be narrowed by fracturing the nose and making it thinner at the top. About 40% of children and young people who have a unilateral complete cleft lip need to have the upper jaw advanced, the so-called Lefort 1 maxillary advancement. Closer to 2/3 of young people who have bilateral cleft lip have to have this upper jaw brought forward. And I prefer to do all these touch-up procedures after the maxillary advancement. Now, when the advancement occurs, the palate comes forward with the upper jaw, and as a result, the palate, the little uvula, may not make good contact with the back of the pharynx so that you start to leak air with speech. And if this occurs, and it's in a small percentage of kids, but if it does occur, it can be fixed with an operation called a pharyngeal flap. And this has to be done under a general anesthetic, and usually this procedure is combined with any of the touch-ups that I've discussed this morning. To summarize, these touch-up procedures on the lip and the nose and sometimes the palate are things that can be done once you're fully grown. These are optional procedures, elective. You're now old enough to make the decision. You can decide whether you want to go ahead or not. Thank you for your attention.